Okay, so I'll be talking about telehealth, a primer on video visits. What exactly is telehealth? Telehealth is the use of telecommunications technology to diagnose, treat, and manage health. So what are some common forms of telehealth? The most common ones are the video visit, as I mentioned, which is the video conference between the patient and healthcare provider. You can think of Skype or FaceTime as an example of how video visits are performed. And then there's other types too that I won't get into today, but I'll focus primarily on the use of video visits. So what equipment do you need to perform a video visit? Well, the way that Medicare defines a video visit is the use of a platform that allows you to perform interactive audio and video telecommunications. Most video conferencing software can be used for video visits as long as it's secure, it's HIPAA compliant, and allows for the secure connection between the patient and provider. There's a wide spectrum of platforms that are out there that can be used. They range price from free. There's free platforms that are out there where the patient and providers are just using smartphones, and then there are more expensive platforms that can be integrated into electronic medical records. So another question I receive commonly are what conditions are eligible for a video visit? Well, there's no real guidelines on this, and it's really up to the clinical judgment of the healthcare provider. What I usually recommend is that any patient that does not require a physical exam or a diagnostic test in the office can be offered a video visit. And I highlight the word offered because there are some patients that do not want to do a video visit, and it should never be a mandatory thing. It should always be optional for the patient. Who can perform a video visit? Most payers will recognize physicians, nurse practitioners, physician assistants, midwives, clinical psychologists, and a number of other providers as video visit eligible providers. So how do you bill and document for a video visit? This is a point of confusion for many healthcare providers. The guiding principle here is that you bill using standard office codes and criteria. So if you know how to bill in the office for level 3, 4, and 5 visits, then you should know how to bill for video visits. There's essentially two different ways to bill. You can use time or medical decision making, and it's the same for in-office visits too. The only difference between billing for video consultations versus in-office consultations is that you do have to indicate using the place of service variable or a modifier depending on the payer that the service was performed via video. And so as long as you're flagging the encounter as a video, then you can use the same CPT codes 99213, 99214, 99215 depending on the complexity of the visit. And so I'm not going to get into the way that billing is done using medical decision making because again it's exactly the same as you would do for an in-office visit. Will insurance pay for the video visits? So most insurance companies, broadly speaking, do pay for video visits and have been doing it for decades. That's really not the important question, whether the patients can conduct these visits from home. And so what I mean by that is that even though many payers have reimbursed for video visits for many years, they've always had a restriction where patients can't conduct these from home. That's called an originating site requirement. And so what that means is that the patient can't connect from home, but instead has to go to a medical office or a physician's office or a hospital or critical access hospital, and that facility has to be located in a health professional shortage area or in a rural area. And so that's the only way that they can connect, which seems counterintuitive because most patients, it seems simpler for them to be able to connect from home. But more recently, one of the reasons that there's been growing interest in telemedicine is that many payers have started to remove this originating site requirement. The current landscape, it's going to depend by state, but in general, most commercial payers, especially payers in states where there's a parity law, will cover video visits, and a lot of them these days are covering video visits from home. Medicaid covers video visits in almost all states, and in 29 states allows you to connect from home. Medicare Advantage does cover video visits, and they can connect from home if the patient has that benefit, and that benefit really became available in 2020. And then original Medicare, which does reimburse video visits and doesn't allow patients to connect from home, but there are some exceptions. Like if you're an alternative payment model, there's certain conditions like substance abuse where they do allow patients to connect from home. Recently, during this coronavirus emergency, there has been Medicare has relaxed its rules on being able to connect from home. So beyond these federal regulations, it's important to think about state-specific regulations. One important state-specific regulation is licensure. So patients have to be located in a state where you're licensed to practice medicine. So I'm licensed in Michigan, so I can't perform video visits with patients that are located in the state of Ohio, and it's the patient location, not the provider location. So if I traveled across the border and I was in Ohio, it would be okay for me to connect with the patient that's in Michigan. I encourage you to go to the Center for Health Connected Health Policy. This is a great reference where there are state-by-state regulations that you can read. All right, that's it. I hope that was helpful.